So today, I'm sure you have much to tell us. Certainly, we should start with our situation of cancer. What can you tell us about that in Barbados and the modes of detecting it that you may have encountered?
Right. Strange and serious times yet ahead for us, not just here in Barbados and the Caribbean, but worldwide as far as cancer is concerned. The terrible news is that around about a few years ago, 2012, the number of not deaths, but the number of folks that came down with cancer was like 14 million. Next few years, around about 2020, that number is likely to double. And what's frightening, you probably remember me saying this about a year or two ago on this program, that we have kids now 10 to 16. 10 years from now, they'll be 16 to 26. And a large proportion of those younger folks that we look forward to build this country on will probably succumb to cancer. One, principally because of the lifestyle and dietary choices which they're making. So when you look at cancer and what causes cancer, cancer is in all of our bodies. Cancer cells are there in all of our bodies, but it's how we fertilize, I like to say how we fertilize that seed.
If you feed it.
If you feed it. Yes.
Stan, I need to ask you this question because as we celebrate Cancer Awareness Month and so many of the oncologists and folks representing cancer organizations in Barbados, the Caribbean, and the world, talking about the progress they've made. That's still, I mean, hearing you this morning.
That's a joke. Very little progress has been made in terms of getting those numbers down. The death rate with cancer, let's take the primary assault weapon used in allopathic medicine, which is chemotherapy. We call it, cut, burn, and poison. Chemo, radiation, and surgery. Chemo has a 3% success rate. That means that every 100 persons that fall down and go that path, 97 will drop dead, 3 will live. What kind of success in the technological age that we live in, where medicine and research in medicine is making such tremendous advances, we're still in the dark ages. That's a failed modality. It's like mammography. Here are pictures. This is a scan for early detection. This is a normal breast image. This is cancer. But mammography missed this, X-rays, so did CT scans and so on. Missed the cancer.
What is this modality here?
This is thermography. It's digital infrared thermal imaging. And it's not looking for a lump. Common sense. Listen, if cancer is going to be there in the body, it's going to be there years before a lump develops. You don't just wake up one morning, find a lump, and realize it's cancer. So why not employ a technology, which is what thermography is, that will be able to look for inflammation, even if you have a rotten tooth. The thermography would be able to pick it up. It's looking for heat or elevated temperature ranges over the surface temperature of the body.
If this technology is such a wonderful way of detecting cancer early, why isn't it more widely used?
Well, you want to get me in trouble, you should ask the oncologist that, because it's money driven. There's more money to be made going down the road looking at chemoradiation as the way forward, as opposed to telling a person, listen, we all have cancer cells in our body. In order not to fall down that path, and we're going to get Christine to live her little story in a minute, you need to make changes to your diet. First of all, you need to, I'm into integrative holistic medicine, natural medicine. So I believe there's a spiritual aspect. So I like to say to all my patients, put it first of all to the master. Let him deal with it. Commit it to him. Then you have to, as my granny would say, that's in the physical realm. Now that's in the spiritual realm. Then in the physical realm, you need to get off your little behind and make changes to your diet and lifestyle. You cannot continue to eat the junk that you've been eating.
How critical is exercise?
A minor role. You know, getting ability to move around and so on. Yes, you could implement a little 5-minute, 10-minute workout program, but exercise is not, has a limited impact on bringing about resolution to cancer situation. You need to look at cellular health, and the health of the individual must be ramped up, one, with the avoidance of putting into the body things which are going to accelerate cancer rate growth or increase cancer cell growth. And by the way, chemo stimulate cancer cells. They stimulate cancer cells. And doctors don't know this because they haven't studied the biochemistry of diseases. You have to go to the scientists and get those kind of answers.
Okay.
Well, let's get Christine involved in this discussion. Christine Drayton, good morning.
Good
You're
morning.
Smiling self, always good to see you. You know,
Thank you.
For the benefit of the Morning Barbados viewers, share with us your story, the battle you had with cancer, how you overcame it, and how you're doing now.
Well, when I was diagnosed with cancer, I had surgery, started the chemo, but didn't finish it. And then I was told about Dr. Stan Odell. I went and I get the treatment for it. And after the treatment, I was sent to get a blood test. And the blood test came back that I'm cancer-free. But the doctors at the hospital did not leave me out. They told me that they're not going to leave me because they wanted to know what happened, that I did not take the treatment and what's going on. So they took me about a month ago and they gave me some treatment also. And the treatment came back, the result came back that I'm also cancer-free. So I'm also taking the treatment, I'm also taking my I'm also using my diet, and I'm also on the treatment that Dr. Stan had given to me. And
She had 2 blood tests.
Why did you not take it initially? Why did you decide to stop initially with the chemo?
with the chemo, because what happened, when I was going to get the chemo, I was told that they take a report of my heart, that they want to know if my heart is strong enough to take this chemo. They started this chemo. While getting the chemo, my heart rate was going up. Heart rate was going up, my blood pressure was up, and I could not get the treatment.
Okay.
They could not give me treatment.
What explanation did the doctors provide after discovering that there was no longer any trace of cancer in the body? I mean, they said you had cancer, they began treatment for it, you didn't finish, and all of a sudden the cancer disappeared. How did they explain that?
And she had 2 tests, by the way. I should mention
tests.
that. She had one about 4 or 5 months ago,
Yes.
and a few weeks ago she had a second test, came back positive. But please answer that question.
Yes, I have I have 3 tests. And when I take the test, I went back to the doctor and I was told that there was no cancer cells in my body. I'm cancer-free. And everything was okay with me. So that was all there was. That was all they said to me.
They didn't explain why the cancer mysteriously disappeared.
No, they did not tell me.
Wow.
But the treatment that I had from Dr. Stan and the healing power of God,
Absolutely.
as a believer, believe in prayer, and my brothers and sisters and my pastor, they prayed for me diligently, and I believe in faith healing. Believe that God was going to heal me because he said that he is my healer, because he bore his stripes, carry his stripes in his body for my healing, and I believe it, and I speak it in my life daily. Speak it in my life daily, and I believe that what he said in his word, it is so, and I believe that is why I'm healed today.
Yeah, that's why you can smile today as well. Good stuff. So Dr. Stan, tell us about this treatment program. What is involved in your treatment plan?
We offer many protocols or strategies. This is actually an image of Christine having the intravenous medical ozone. This is a procedure similar to similar to kidney dialysis, where the blood exits the body, is bombarded with ozone, and ozone, by the way, like oxygen, kills cancer cells. The blood is then returned to the body as a bright red. This is part and parcel of the technology or the protocols that is being offered right now in German cancer clinics. And we have some of the same offerings here at Health for Us Clinic in Barbados. In fact, we're the only clinic that mirrors pretty much in terms of modalities and strategies for cancer treatment as close to, or if not on par, with the German cancer clinics. So we do things like electromagnetic field therapy, we do vibrational medicine therapy, infrared saunas and detoxification, powerful nutritional supplementation. So if a patient comes to us with cancer, they have the best possible chance of allowing the body, through services we offer, to bring itself back into balance and to sharpen up or boost up the immune system.
Okay.
Is there some type of supplementation that would replace some of the kind of foods that you're so critical of?
Well, it doesn't matter, and that's a great question, Doc. It doesn't matter even if the person is a super duper vegan or vegetarian. What we eat today, and that's known, you don't have to be a food scientist or an agronomist or anything, what we eat today by way of food, doesn't matter how good you think it is still devitalized, because the soil in which these things are grown is devitalized. So I say to folks all the time, cancer prone or not, disease prone or not, you need to be taking somebody's supplements on a daily basis. That's really the bottom line. And that's one of the things that we're very, very firm on in getting the patient to comply. If they're not willing to comply, I simply do not waste time, because this is a small community. We want people, when they come, to be able to follow through, get good results, and hopefully bless others with their testimonies.
Okay.
Dr. Stan, I imagine for a moment, your techniques are considered unorthodox.
Well,
by today's standards in the medical profession.
They're natural medicine therapies, and they go back from time immemorial. Yeah,
Okay.
It's God's way of doing stuff as opposed to man's way, because as a scientist, I will tell you that our methods have failed, and they cannot replace God's technology, God's method, which is really going to nature. He said He's put the herbs on the earth for our benefit. And by the way, my first degree is in chemistry. I used to make the very drugs that go on the drugstore shelves. We used to send out what we call botanical scouts. I call them thieves. To the Amazon, to Africa, talk to my brothers down there, the Amazon, talk to my cousins, and find out what herbs were good for whatever. And they came back, and over the laboratory bench, we used to synthesize those drugs that now go on the drugstore shelves. Are there benefits? Yes, there are occasional benefits. But God, in His wisdom, put hundreds of chemical compounds within a herb, a bark, a root, a shrub, a berry. You cannot expect to take out the active component that you see there. You can patent it. Yes, you're not going to make millions, hundreds of millions of dollars, but there are side effects because you've taken it out of its natural environment. And this is where pharmaceutical medicine fail and will continue to fail. Cannot replace nutritional support.
What is the process? Should someone watching, maybe even under the advice of their own Western medicine doctor, want to try your way, Dr. Stan, what is the process? What do you need to know about that?
The process and another super question. What they need to do is to do what most European doctors are now doing. The medical doctors in Europe are working closely
Complementary.
with persons like myself, because I understand there's a time and place for operation. There may even be a time and place for a little surgery, so for a little chemo or a little radiation. But by and large, if you hold that out as the banner with which you're going to resolve each and every cancer, that's a failed theory. It's not going to work.
Okay.
So working together, hand in hand, we can offer our patients tremendous, tremendous help and hope.
How
And
can
we're
they
seeing
reach
it.
you?
253-5858 is Health or Us Clinic. My name is Dr. Stan Odle. 253-5858 and 624-3612. Or you can email me at myhealthdoctor, and doctor is spelled out, at yahoo.com. myhealthdoctor@yahoo.com. And our consultations, by the way, are totally free. I think I'm perhaps the only doctor in the entire Caribbean that do not charge a consultation. And it's necessary because people need information. We're seeing too many, and by the way, we have some young folks that are coming up to this threshold where cancer is knocking on their doorsteps. Right now I'm treating about 3 youngsters with various types of cancers.
Okay, excellent. Thank you very much, Dr. Stan, for sharing your message with us on Morning Barbados. We met and heard her story, cancer survivor Christine Drayton. Thank you for sharing as well.
Thank you.
And thanks, Dr. Stan Odell of Health RS Clinic. The number again, 253-5858.
558. You may
Okay.
also catch me tomorrow afternoon on VOB at 2:45. Thank you.
Okay, we'll take a break and we will be right back.